We are going to wait just a moment here to get everybody in. Make sure I'm on Facebook Live, get that going. Okay, welcome everyone. It is 3:01, so we're gonna get started here. So just a few housekeeping. My name is Kelsey Doom. I'm the president and CEO at the Brookings Area Chamber of Commerce, and I am going to moderate our panel today talking about COVID-19 and how it is guiding our community. So we have some community leaders here, and just to kind of inform the public and educate the public, answer some questions on why we're making the decisions we are, and a little bit more about the how and why on COVID and how it impacts our community. So if you all have questions, if you go to the bottom of your Zoom on the toolbar, you see a Q&A. That's how we're gonna accept questions at the end if we have time. We have a lot of questions to go through, so if we don't get to your questions, we will be posing those to the panelists afterwards, and I'll put them out on social media. So to start off with, we are going to introduce our panelists. So first off, we have Paul Briseno, City Manager. Paul, do you want to introduce yourself?
Sure, Paul Briseno, City of Brookings. Been here for almost 2 years now, coming up on June, and very proud to be your City Manager here in Brookings.
And with the City Manager, we have our Mayor Corbett. He isn't a panelist, but he's going to be here as a resource for us. My mistake, I marked Patty Bacon and Keith Corbett as panelists. They are here and present if we have questions, but they're not going to be panelists for us. Dr. Specker, do you want to introduce yourself?
Yeah, I'm Bonny Specker. I have my PhD in epidemiology from the University of Cincinnati, where I stayed on as professor of pediatrics at Cincinnati Children's Hospital until 1997, when I moved to Brookings to head up the Martin program at SDSU.
Very nice. Okay, let me pull this back up. And Mr. Merkley, do you want to introduce yourself?
Sure, thanks, Kelsey. Jason Merkley, I'm the president and CEO for Brookings Health System. I've been in this role for about 8.5 years now, and looking forward to the opportunity to tell everybody about information from the health system standpoint. So thanks for having me.
Awesome, thanks for being here. And Dr. Smith.
Hi, thanks for having me. I'm Sarah Smith, and I've been in Brookings doing family practice medicine at the Avera clinic for 15 years. I got my medical degree at the University of Nebraska Medical Center in Omaha. Hopefully I can answer some questions for you. Thanks for having me.
Awesome, thank you so much. So we are going to get going here with a little presentation from Dr. Specker. Some of you may have seen this at the City Council meeting and on the City website, but she's gonna give us a little brief version of that. So I'm gonna go ahead and share my screen.
You can just go to the second one, Kelsey.
Okay.
So what I want to just mention a little bit to start off with is how the COVID-19, some of the similarities between that outbreak now and the 1918 influenza outbreak. This just showing some comparisons of the sanitation workers at the time. Next. And how the healthcare system at the two different times, some of the ways they've reacted. Next one. And then also the demands that it has put on the medical system, both in 1918 and now. Next one. And just a little sort of refresher, the influenza of 1918, as an epidemiologist, this is one of the biggest outbreaks that we learn about. It was really a horrible pandemic. It happened first in Fort Riley, Kansas, where about 100 cases were diagnosed within a within a one-day period. And then it sort of died off for a while through the summer, just like flu does. And then the following fall, in the fall of 1918, there was a much larger peak. Then it died off, and then there was a third peak in 1919. About a third of the world's population was infected by this virus, and there were 50 million deaths worldwide. There were 675,000 American deaths. The thing that's very different about this virus from 1918 and the current one, so one in 1918 really affected the younger population. So individuals in their 20s and 30s were the ones that were actually dying from it, which is different from COVID. But the fatality rate of the influenza of 1918 was about 2%. And you can teach entire classes on this particular outbreak. There's a lot of interesting things, which we will not do today. Go on. There are a couple, I think, important things to compare between the two. First, in the influenza of 1918, the reason so many people were infected was that it was a new virus and no one had any prior immunity. This is true for COVID-19. There were no vaccines back in 1918. This is also true for COVID-19. So the only control efforts are limited to non-pharmaceutical interventions. In 1918, that was not applied very often because in 1918 we were in the middle of a world war. That was World War I. You had a lot of people coming together for war bond drives and parades, and you had men being recruited to go fight in Europe. So there was a lot of, or lack of, social distancing. And there was no limiting of public gatherings, very different than what we have now. I think it's really important to realize that the coronavirus, this COVID-19, is more than just the common cold. There are a lot of coronaviruses that do cause the common cold, and they're listed here on that second bullet. But those infections are usually limited to the upper respiratory tract. And there are 3 coronaviruses that really affect the lower respiratory tract. That includes SARS, that was around in about 2002. 10% of the people who got SARS died. 20 to 30% of them required mechanical ventilation. Then we have the MERS that was around in 2012. And there's about 2,500 cases of MERS, and it is not transferred human to human. So if I had MERS, I couldn't give it to somebody else. It's an animal to human transfer. Now we have SARS-2, which is the virus that causes COVID-19. It does have human to human transfer, which makes it harder to control. Next. And this is just a comparison. I actually made this slide in the beginning of March. It's still pretty relevant. SARS, there's been a total of about 8,000 cases. It has a fatality rate of close to 10%. Cases were identified in 29 countries. You have MERS, 2,500 cases, about 860 deaths. So 35% of the people who got MERS will die from it. It has been found in about 27 countries. SARS, and this is SARS-2, the COVID virus, and this data is limited just to Wuhan back in February. It had already affected close to 73,000 people. Now we're getting, 2 or 3 million? That's the next slide, but not yet. And there were 1,800 deaths back in February. And Wuhan, the case fatality rate was about 2.5%, and China at that time was the only country reporting it. Now the World Health Organization is actually estimating the mortality from SARS-2 to be more like 3.5%. So one thing I just want to say about that is even though the mortality rate for SARS-2 is lower than those other two coronaviruses, it is much more easy to spread so that a larger number of people are affected and there will be more deaths from SARS-2 than SARS and MERS both. Okay. These are the numbers as of yesterday afternoon. 2.5 million people in the world have been diagnosed with this virus. The numbers that you see along that graph are the numbers that were for February 1st, March 1st, and April 1st. So 9,800 February, 87,000 in March, 930,000 roughly on April 1st, and now we have 2.5 million. Next one. This is the situation in the United States. Along the axis here, we have the actual months and days. As of yesterday, there were almost 814,000 cases, and there have been 45,000 deaths. The deaths do lag behind the diagnoses by about 7 to 10 days, so there is a lag, and I think that's one thing to remember when we look at the South Dakota data. Next one. This is the South Dakota situation as of 11:30 today. There have been 9 deaths. There are 62 people currently hospitalized with COVID. 18,058 individuals have tested positive. About close to 12,000 have tested negative. And this is the number of cases that have happened over time. And as many of you are aware, a big chunk of this is from the Sioux Falls area. So if you break down by Sioux Falls versus the rest of the state, so is on the next slide.
Which I think you meant 1,858, not 18,000, correct?
Oh yeah, 1,800, sorry. So these are the data for Sioux Falls and then non-Sioux Falls. And you can see this big peak happening. This is with Smithfield. But you can also see that for the non-Sioux Falls area, the case numbers are increasing. And if we look at projections, some of these models that are out there, people are estimating this will peak in around June for the non-Sioux Falls area, the middle of June. Next slide. As I had mentioned, the deaths are kind of lag behind the number of cases. And today we had another death and one yesterday. These are shown here. And I would imagine that within the next week, there will be quite a few more as this starts following that curve that was on the previous slide. So this is just something I did a long time ago and before I started actually making models, because at the time I did this, we didn't have enough data to do any projections, but it was based off of what was known at the time. So this was done the early March, and I kind of leave it in some of these presentations because I'm curious to see if it ends up where it ends up. But looking at Wuhan, you know, it has a population of 11 million. About 0.7% of the population developed COVID by the beginning of March. You know, we have 880,000, and we have roughly 2,700 hospital beds in the state of South Dakota. So if 1% of the population of South Dakota gets this virus, that's going to lead to about 8,800 cases. And based on the Wuhan data, roughly 20% of those are going to be severe or critical. And based on the either the mortality rate, hold on. Is it still up? Because I don't see it anymore.
Yep, it's up. The slides are up.
Ah,
You got it back?
no, oh wait, here. Okay, so if 20% of them are severe or critical, that'll be about 1,800 cases. And if you have a 3.5% mortality, that will be roughly 300 deaths. If you look at the mortality among those severe or critical cases that was observed in Wuhan, it'll be about 350 deaths. So with COVID-19, we end up going back to that slide with the influenza of 1918, that the only way of limiting the spread of this disease right now is by isolating cases that are diagnosed and quarantining those that are exposed to the virus. Using good personal hygiene and disinfectants, and also limiting public gatherings. And the whole goal is to flatten this curve, or that you're seeing with social distancing. If that curve is not flattened, you end up overwhelming not just the medical system, but also healthcare providers. And that's it.
Awesome. Let me get back here. Thank you so much for that.
Sure.
Let's see here. Okay, so we have all this background information. We talk about all these cases. Dr. Smith, can you maybe talk to us a little bit about who's responsible for investigating these cases and notifying the public? How does that all happen?
So the South Dakota Department of Health is who is tracking the cases, and the information that we get from them is based on positive tests. So I do want to mention that even though we only have a small number of positive people who have tested positive in Brookings County, we are seeing people that are coming through our respiratory clinic. It's a clinic where we are seeing people with fever and cough and shortness of breath that could be potentially have this virus. There are many that we turn away from testing because we're not at a level, we don't have the ability to test. So I do want the community to understand when they look at the numbers that these are really only the numbers that have been tested and have been positive. We think there are lots more that are out in the community that have symptoms but don't meet criteria for testing because they're not pregnant, or they're not older, or they're not related to the healthcare field. So just keep that in mind as we think about numbers today.
We wonder, oh, go ahead, Dr. Specker.
Another important point, there's studies coming out of both Iceland and Italy that are showing that close to 50% of people that are testing positive for this virus have no symptoms at all, but they are able to infect other people.
Absolutely.
So, and that is, I think, really important to be aware of.
Yep. And so we do talk to, just the message that if you're sick, you should stay at home really doesn't capture the message that that you could have the virus and have no idea that you have any symptoms. We think there's going to be a high percentage of people that have this and recover from it with minimal symptoms. And so when we talk about prevention and protecting others in the community, and we can talk about this at another section too, is just about how wearing masks can reduce, you're really focusing on reducing spread from yourself, not really protecting yourself from other people necessarily, but to capture any droplets, because if you're infected and have no symptoms, you don't know, we don't know that you could potentially spread it. So that's another thought that is really important for the public to understand.
So you're wearing the mask for the others and not to protect yourself.
So the goal of wearing the mask is to capture droplets as they come out of your nose and mouth with speaking, coughing, yelling, breathing, and you are wearing that mask to protect others. And so overall that helps the community. So it's an action that individuals can take to help prevent spread and protect the community.
And why don't we know more specifics about the cases? Wouldn't it be helpful for us to know, if they go to our church or they are part of our daycare system, why can't we know more specifics on who has the coronavirus?
Well, so one of the main things, and Bonnie can speak to this too, but one of the main things that we do in outbreak situations is contact tracing. And so we would have to have a very vigorous program. Other countries have instituted contact tracing that's non-voluntary. It's, something that the government is making people do. So they're watching where you go, who you're in contact with, what stores you've been to. In the United States, it would probably be more of a voluntary, you'd have to enroll or be, be willing to share some of that information about who you've been in contact with and what locations you've been in. But contact tracing would give us more of that data, but we don't have the power,
Yeah, the Department of Health is doing a lot of contact tracing. I know from the Martin program, we have 4 people that are now doing contact, God, that's a tongue twister, contact tracing for the Department of Health. And they will be training the National Guard next week to start helping the state contact all these people. Because if you think about it, this is a virus that if you have it, on average, you're going to give it to 2 to 3 other people. So the numbers can just balloon really, really fast. And what you have to do when someone is diagnosed is find out who have they been around for the last 2 weeks or a week before they had symptoms. Find all those people and then get them to isolate themselves because they could have it and be contagious.
Right.
So if that falls apart and someone has it, doesn't know it, and goes out, then you're going to start seeing peaks. So this contact tracing is really, really important way to try to get the spread of this disease under control.
And
we have the Care19 app, which we can talk about if we have time towards the end here. Jason, can you talk to us a little about what the hospital is currently experiencing and maybe go through, I don't know if you can share how many COVID patients have been admitted to the hospital, how many COVID-19 patients can you treat at one time?
Sure. Experience here has been, I would say, moderate. You got to remember that we have many patients, as Dr. Smith had mentioned, that come in that have symptoms that look like they could potentially have COVID. So we treat them as though they have that. Obviously, we test them. We send that off to the lab. It takes a while to get the response back. So we're obviously isolating them, doing all the precautions that we need to. We have had a handful of positive patients that have been hospitalized and or been through surgery here. So we are taking care of those individuals. I would say that we have a robust plan. We've been preparing for this for quite some time. We have a plan that is able to meet internally within the walls of the hospital, up to 80 patients at one point in time at any given day during the peak or the surge. So we have identified basically about every area that's available to us. The challenge becomes when you get to that point in time, how long you can have a sustainable workforce to prepare and have the needs available for those patients. And so we have obviously isolation rooms and other things within our facility that the sickest folks would be in, but it really gets down to how many people you have available that you can potentially care for, whether it's within our walls of the facility or in an alternative care site that we don't feel right at this point in time probably needs to be lifted up at any time because we feel like we can handle that surge. And Dr. Specker's modeling kind of states some of that if you would apply that to the Brookings County area. It's a little challenging because we do have referrals that come from outside of Brookings, but at the same point in time, once you reach capacity or you hit some of that surge, other places are going to have to step up and do the similar type of planning and preparedness and taking care of those patients like we have here. So we have notified those places that they may have to care for individuals that are sicker than they usually care for. And we're here to help them if we can. At the same point in time, we can't take all those folks if we have a wide outbreak here within our area.
And they say when a patient gets critical, they need a respirator. How many respirators do we have at our local hospital here?
So I can tell you that we have a handful of respirators, and which is probably usually in these sorts of situations never enough. It's similar to what you see. We've requested others. Some of the challenges that we have is, lots of those patients today in our current state get transferred out of Brookings or in a medium-sized community like Brookings, and so they go to Sioux Falls. Obviously, depending on when the peaks and surges happen and what capacity is available in those areas, because to run a ventilator takes some special management by special people that have some obviously ability to do so. And so since we don't do it on a day-to-day basis, not that we can't, but we certainly don't have the subspecialty care here in Brookings to be able to do some of that, and we don't do it on a day-to-day basis. Now, we could do it in a pandemic and when we are all at surge, so we're prepared for that. But as we see across the country, when it gets to that level of care that needs to be provided to that many people, you probably, unfortunately, don't have enough of those, enough of that equipment.
And you mentioned Sioux Falls. What impact do you see what's happening in Sioux Falls having on the Brookings area? Are you going to be taking overflow? Is overflow a thing right now? What's that status?
So I think obviously they're as prepared in Sioux Falls with their plans. We have talked to them and mentioned that obviously if they have non-COVID patients that are less acute and they need bed space and some of those sorts of things, I think you'll find that Sioux Falls would transfer some of those patients out to us. Obviously, they're a long ways away from that at this point in time, but we certainly have offered that based upon the fact that we're not at that point. Mm-hmm. And so I think there's opportunities to that. I've been very proud of what this community's put forth from a standpoint of seeing what we've done and being proactive to try to do some of the things, again, that Dr. Specker mentioned in regards to social distancing and taking the necessary precautions and staying at home, et cetera. I think that's allowed us to be able to be in the position that we're in. And so if we continue to do some of those things, hopefully we don't have or we don't see that surge and peak maybe till later, or maybe it's not nearly as worse or as bad as it might be given our dynamics that we have in Brookings and Brookings County.
Mm.
I also think that's an important thing to remember, like when people say, oh, it's not as bad as everyone projected. So, it's just sort of been a big hype. Well, you don't want it as bad as people projected. If it's not as bad as what was projected, that means people have done a really good job of socially distancing and slowing down the spread of this virus, which, you can see from Smithfield how fast that can get out of hand. And, I'm hoping the projections are all wrong. Even so,
yep, we all are.
That would mean we did a really good job, and
yep,
let's keep it that way.
Dr. Smith, you might be able to answer this one. So one thing that I've heard, they being news outlets and different people chatting on national news are saying that flu and pneumonia cases have seen a decrease. So is this true because we've been washing our hands and social distancing, or how do we not know that those cases are lumped in with COVID and that it's not being inflated to inspire fear?
Well, so when I've been looking at the influenza graph, the number of cases is following the what influenza does every year, so seasonally. So about this time of year, it just drops off. And so we would expect that. We've stopped testing for influenza because we just haven't had any positive cases. As far as pneumonia goes, some of the symptoms are similar, but some of the lab testing that we do and the x-rays that we do, we are really able to tell a difference between what is pneumonia from a bacteria. This looks very different on an x-ray, and the labs are very different than what a patient who presents with COVID-like symptoms, what their x-ray and their lab looks like. So we on the medical side, it's not, there may be some overlap, but it's not difficult to see the difference. So there's still people who are going to be admitted with pneumonia, and pneumonia can happen at any time of the year. There's certainly some seasonality to that too, but not so much with influenza. So I'm not sure. I mean, certainly hand washing and, social isolating might help reduce other infectious illnesses.
Mm-hmm.
But to me, the two disease processes are quite different.
Okay. And Dr. Smith or Dr. Specker, one of you might be able to answer. One thing that we're hearing a lot more on is herd immunity. So what is that? And one of the questions here is why or why not should it be considered here in Brookings?
So herd immunity is when there's so many individuals that have developed the disease and have immunity to it, that it's difficult to transmit the disease within a population. One way of getting herd immunity is by actually having the disease, and that's assuming that you become immune to it, which is right now a big question mark with COVID. People don't know if people that have had COVID develop an immunity to it, so that's a big if. But things like measles, once you have measles, you're not going to get it again. You also have vaccines, so vaccines will make someone immune to a certain disease. Depending on how infective that disease is, how easily transmitted it is in a population, you can calculate what % of the population has to be immune for it to not spread very easily. In the case of measles, that's somewhere in the 90% of the population has to be immune because it's very infectious, okay? COVID is not as infectious as measles. It's less than that, but you're still going to need a high % of the population that's immune. Right now, if you look at a lot of these countries, roughly 2% of the population is estimated to have COVID. So you're going to have to infect a huge number of people, assuming that COVID gives you immunity. And that's going to lead to an overwhelming the medical system. I mean, eventually you want everyone to eventually have immunity to COVID. But you want that spread over a very long period of time. Otherwise, I mean, you don't want Dr. Smith to have to decide who's going to get the ventilator. So you want it to be a slow process. I personally would rather have the vaccine than the disease in order to develop that immunity. So the key right now is buying time to get a vaccine developed to give a high enough % of the population herd immunity so that the disease no longer is transmitted as rapidly as it is now or as easily.
Okay.
I would agree. I would agree with everything you said there.
Perfect. Good job, Dr. Specker. And we have Paul making his debut with his first question here. You ready, Paul?
Yes.
So help the community understand the city's need to pass and extend that ordinance that affected bars, restaurants, gyms, et cetera, after that first case in Brookings County.
Sure. So initially it was implemented in March 23rd. The council then revisited it. And upon revisiting it, we also started crafting the stay-at-home ordinance. At that point in time, that's when we brought the council in and visited with a lot of these medical professionals. Now, I'd been meeting with a lot of them since February, probably the end of February as a city manager. We meet about every other day on our pandemic response. but also more locally through our emergency operations. We meet every 2 or 3 days, just trying to understand the pulse of what's going on in the community. I heard a lot of great information that I was conveying to the council, but the council also had a lot of creative questions. You know, they're essentially making these decisions for this community. And so the council had that opportunity to listen to them. A lot of this information was shared with the council. And so that's basically what the council and I as staff is going off of, is what we're hearing from our medical professionals, but also taking into consideration what's going on in the community from a business perspective, trying to work with people within the ordinance, within the CDC guidelines and OSHA recommendations, while still providing good social distancing. So that's kind of what took place as far as bringing this together from an ordinance perspective.
And in that, gyms were included in that ordinance, and then salons and spas were added as an amendment the day of its first passing. So why were those entities, help the community understand why those were forced to close down?
Sure, that was added as an amendment by a city council member, and then voted unanimously to add it. A lot of these ordinances that we're seeing across the nation, in fact, ours was modeled after one in Wyoming and then addressed to fit our community. A lot of them did have gyms and salons noted within the language, and specifically the salons and barbers, because they cannot do the work with practicing good social distancing. They have to physically touch the individual, and so that's the primary reason there. Gyms, what I understand is that a lot of these materials can contain the virus for multiple days at end, and therefore, as you have multiple people going through these different stages, if it's not adequately cleaned, it's a good opportunity to continue the progression of sharing that virus.
Got it. So Jason or Dr. Specker or Dr. Smith, would you say that ordinance did its job? Was it effective? Do you think, what were the results from that ordinance being put in place?
I think so. I mean, I think it just raises awareness in the community about how important it is to distance, and it's just speaks to the city, the priority to protect the hospital and to protect healthcare workers and to protect lives in the community. So I do think that has been helpful. You know, just looking at the graph that Dr. Specker showed about what's going on now, we just don't know what the future holds and when we will see our peak. I think people are frustrated because they're kind of like shrugging their shoulders and saying, look, we've got nothing here, but we know it's coming. It just depends on how fast and how severe when it does hit the community. So
awesome.
Yeah, and I would agree. I think that Dr. Smith said it well there, and totally in support. And we were certainly part of those discussions early on with the city and the city council. And so I do think that's had a great impact on our low number of cases that we've seen here, as well as other communities have seen across the state and in similar type of mid-sized communities. So it's certainly been positive. And as Dr. Smith mentioned, you know, now is not the time to let off the gas just because we've kind of stayed status quo for a little bit of time here. We still want to obviously do the things we can to be whatever the new norm might be for our future.
Right. And that's a great segue into the stay-at-home order. So we had the first reading last week, so that if multiple cases come up and the city council has the kind of the preparedness to go in and say, okay, it's time to implement this stay-at-home order. So Paul, maybe you can talk about the stay-at-home order is more restrictive. So how will that change the typical person's day-to-day, and how effective will this be in combating this pandemic locally?
You're exactly right, Kelsey. This is the next step in more restrictive measures to try to curb the spread of the coronavirus. Once again, we hope this never has to be implemented. The council did have the first reading, so at any point in time now moving forward, they can have a second reading and it goes into effect immediately. Really what the ordinance does is it tells people that they can leave their house, but only for essential duties and tasks. And those tasks include anything from working at essential jobs or doing some of those essential functions, such as going out, getting groceries, getting gas, taking kids to daycare. So people can still live their lives to an extent, but once again, the ordinance does focus on social distancing. And so it also focuses on essential and non-essential businesses as well. We currently have a tab on our on our website called the COVID tab. Businesses that are interested in understanding whether or not they're essential or non-essential can go there, and we can then go through an analysis based on what they submit and determine whether or not they're essential or non-essential. So it does regulate a lot further what businesses can and cannot open. It also regulates what citizens should and should not be doing. The initial ordinance that we had that we have right now is a little less restrictive, but that basically tells everyone what you cannot do. The stay-at-home ordinance pretty much tells everyone what you can do. So you can still go to the park. You still can exercise. You still can go out in your front yard. You know, people here stay at home and they think, I have to stay put. And it would be nice if people did and practice good social distancing, but the ordinance, the way it's written, still allows people to live their lives, still allows people to enjoy the beautiful days that we've had here the last couple days, and continue to have a life while respecting the need for good social distancing.
So to the medical community here, when would you say this measure should be implemented? When would you give the go-ahead to the city council to say it's time to put this stay-at-home order in place?
You know, I'm not sure. I'll maybe let Dr. Specker, do you have a thought about that?
I think when you see an increase in the cases that are indicating there's community spread, you know, it's not someone who was down in Sioux Falls and moved to Brookings, or, I mean, it's something that's more local. That, or I think having a couple cases from the same industry or company would be sort of a red flag of trying to get in there and stopping it from becoming a Smithfield.
Okay.
I just want to say that we know that locations around the country who have had stay at home. So when you compare it, places like California who've had relatively low numbers versus other locations that have had high numbers, it's clear that can be a helpful tool. So just to keep that in mind.
I've seen articles too that have actually shown that economically those communities are thought to be recovering quicker than the ones that delayed the stay-at-home orders.
And when we talk about, we see other states that had these stay-at-home orders and are now lifting those stay-at-home orders and reopening. So when would we haven't seen the worst of it yet. We're kind of behind the rest of the country is what I'm learning. So when can South Dakota and Brookings look at the data and say, okay, it's time for these measures to be reduced. We can take our foot off the pedal a little bit, as Jason would allude to.
Well, I think that it would be in a staged fashion. You know, we would see that, we would start to allow certain members of the community to be more mobile, and see what happens to our numbers for a week or two, and then ease restrictions further. I don't think it would be just like a free for all. Okay, we're all going to go do whatever we want to do. So it will be, based on once we see peaks and numbers start to drop. I think that nothing would be released until we were to see a peak and start to see a drop in numbers. Okay.
What do we know about the new medical trials occurring in South Dakota?
The current hydroxychloroquine trial that has been approved through Sanford and also Avera and what's the other health system, Jason?
Monument.
Out west. This is not for treatment. So I just read the update, and even some of the healthcare providers across the state are still in the dark on this. So this is not for treatment. This is for prophylaxis. So it's going to be for people who are healthcare workers and have an exposure, or for high-risk patients who have an exposure. So before symptoms even begin, the hydroxychloroquine, it'll be a trial where you would not know what medication, the patient would not know what medication they get. You would either get hydroxychloroquine or placebo. So I do want to mention that I've been reviewing a lot of literature about hydroxychloroquine, and the data is not really there to tell us that it's helpful. There's a lot of mixed data. There's certainly harm that can occur with this medication, so it gets a lot of press. But from a medical perspective, I think we are watching other studies. There's a big study at the University of Minnesota. There's been a VA study. And so some of these studies have actually stopped a certain arm of the study because of harm. So patients have been doing worse with this medication. So I don't want people to feel like this is kind of a panacea, hey, we're lucky we get this medication and everybody's going to get it. We are not there yet.
Okay.
So with any trial, we have to implement it in the right way and ask the right questions and study it and then publish it so that we can understand if it's a helpful medication or not.
And we talked about, droplets and wearing a mask, but then you also see instruction to, for example, wipe down your groceries when you get home from the grocery store before you put them in your cabinet. So how transferable is COVID-19 through the surface contact?
So really, we don't have a lot of data to show that it is passed that way. So I think that the latest that I've heard from infectious disease specialists is that it's fine to get takeout food. It's fine to go to the grocery store. Probably the most important thing to do is to wash your hands when you get home before you unload your groceries. To probably wipe down your steering wheel, maybe some door handles. But beyond that, we really haven't seen that COVID cases are coming from, the stocker that stocked the shelves with the box of cereal, and then you bring it home and wipe your nose and then you're sick. So that's not the main transmission. Really what we're seeing is person to person within that 6 feet distance, droplets, direct contact. So I think that is one thing I feel pretty confident in reassuring people that it's okay to go get groceries. Be smart, wash your hands. If you go get gas and you pump gas, when you get home, wash your hands. That's probably the most important message.
Okay. Paul and Mayor, what are the numbers looking like? Have you guys gotten any sort of economic impact numbers to know what impact this is having on our community?
I know we sat through a leaders roundtable this morning where the Economic Development Coalition did provide some information from a company called Buxton, who does analysis through credit cards, but also cell phones, which is great information. We're also receiving sales tax information from the state. Unfortunately, that's about a month and a half out. So really, we won't know April's impact until May or June. And that's difficult because that's when we're starting up our budget process, which will impact our operations, outside agencies, and programming as well throughout the community. So right now we're actually asking the state to prolong the budget process for about another month or two so we can have good, accurate numbers. But unfortunately here in the state of South Dakota, we don't get good information on where our sales tax comes from. No other business would operate this. It's kind of my soapbox. We get about 45% of our revenue from sales tax. We have no idea where that comes from. But with that said, we are anticipating a loss in sales tax of about 30%, and that's just from what we're seeing from other states who are openly talking about this. Potentially 10% loss in property tax, and then our 3B and our pillow tax especially will be decimated this year. And that's where our CVB, our chamber, our BEDC heavily depend on those dollars. Therefore, we're doing whatever we can to mitigate those expenses or those revenues with expenses, offsetting our operationals, looking to cut projects where possible, but at the same time, still trying to move forward because we need some normalcy in our lives. But having those conversations with our community partners, such as the chamber, be well prepared of what might happen in the future.
And talk a little bit about the city's emergency call center. What can you tell us about that?
Sure. So this was actually modeled after a community in Colorado. We had an employee, a number of our employees have brought forward some great ideas. This was brought forward by a lieutenant in the police department. The idea is to have a call center to take on any calls that would normally go to the hospital or to the Avera or other medical professions to try to take some weight off their shoulders so they can concentrate and do what they need to do while still providing a service to our public. Right now, we've only received about 15 calls a day, and the assumption is that will gear up as we start seeing a peak here in Brookings. We hope that we never really have to maximize that call center, but we do ask people to call that first if they want to find out more information where they should go. But if they are systematic, if they are having issues breathing, we ask that they call their medical provider immediately or 911. So once again, that is a great service. We did anticipate potentially using 211, but that system only has about 20 to 25 people throughout the entire community or the entire state. So our concern there was our community first and foremost. If something goes south and we need a call center to help out our healthcare professionals to ensure they don't get overrun, we wanted to make sure and have that available. And that's manned by our non-essential employees. A lot of our employees volunteered to provide that service. So doing a lot of great things internally with our employees.
That's awesome. We talked a little bit about events and you know, CVB and the Chamber. The Chamber has really great events happening in the summer called Downtown at Sundown. You know, there's also the drag races that people love going to and things like that. What are the panel's thoughts on open air events when there's more than 10 people in a specific area? Are we going to be able to have these events and go enjoy our summer with groups of people?
I think that you really need to somehow enforce the 6-foot distancing. That is more important than it being outside.
And what about group size? I mean, is that kind of just impacts the social distancing capabilities? Is that what you're saying?
I'm thinking the 6-foot distance is probably more important than the group size. If you can have 20 people spread out over 4 acres.
Yeah, I mean, my concern is that how do you, you know, by saying we're going to have this, but you have to be 6 feet apart. I mean, you really can't, you know, I just don't think that you're able
Right.
to enforce.
That's true. It's harder to enforce the
And
6-foot distancing than it is the crowd size.
yeah, so I think until we see that peak, until we start to see numbers drop, you know, and then, like I said, we're going to allow small groups to get together first and then larger groups get together. Hopefully we'll be able to have some of those things later in the summer, but people need to take a long view and not be thinking about what's happening here to me today, but we're thinking about, you know, this is just this, it feels like an eternity. This is just a blip, and you really have to be thinking about people in the community that are vulnerable, and then also just our medical resources. So I would have people reflect on that.
And I would just add, I think this is some of the challenge that's in front of us as we begin to try to now plan for what the new normal is. And so lots of places across the country are just starting this process, and it's no different, I think, here in South Dakota, although I do think that we're behind the curve from some other places on the peaks and surges. I will say that, you know, we have to begin to plan. We put countless hours into planning for the pandemic and the surge and how we are going to combat this pandemic here in Brookings and Brookings County. It will take as many hours for us to figure out how we're going to continue to live our lives in the future, whether it's this summer or this fall or this next winter, because COVID is not going to go away come June, July, or August. It's still going to be around, and we just have to figure out what that's going to look like and how we start to reintroduce everything to whatever the new normal might be here in the future.
And I mean, I would anticipate that there will be little blips here, and we'll institute more stay-at-home orders or, you know, self-quarantine. It'll calm down, and then we'll see another blip, you know. So I think that Jason's right about that, is that we just don't know globally, let alone locally, what this holds for the future.
Awesome.
I agree, but I also think that you can look at it as an opportunity of how can Brookings do some of these things in a creative way. I mean, it's sort of like the fire trucks and the police cars for your birthday. I mean, that's just so cool. And I think that there are ways of doing, you know, the city and the county can do things that result in the same sort of sense of community that the Thursday nights downtown bring about.
Yep. It's been if there's any silver lining in this entire pandemic, it's watching businesses get innovative and change their business plan on a whim. It's been very interesting. The last question I'm going to ask, our state, our nation deals with mental health, and we have a lack of resources here in the state. With people being quarantined and the impact it has when you're laid off or a loved one is sick is going to cause even greater mental health concerns. So what are the resources to respond to any sort of mental health concerns that people might have as they experience COVID-19?
So that can be very overwhelming for people. I think that the most important thing to do is to call and let someone know to reach out. Because if you contact me at our clinic or one of the providers at Avera, we're going to get you help either through a virtual visit or a telephone visit, or referring you on to a counselor who's doing phone check-ins or virtual visits. The COVID hotline in Sioux Falls has done a great job of helping people understand, are your symptoms related to COVID? Or you may be having a panic attack, or some of those things, and so to help people understand that they're maybe not sick, but that they're having some anxiety. In addition to that, though, I want to say that it is not something that we can just fix and put a Band-Aid on. There needs to be community response, and so people need to be checking in with their neighbors, by phone and reaching out. And so that is something that the community needs to do. We can't be taking care of COVID patients and all of the, mental health issues, and we'll do our best. We're here to help refer you. But I think that that's a community effort.
And Paul, you put something in the chat here, and we have some people on the phone that can't see the chat. But Paul, can you talk about what you just put in there?
Sure, and this is just some of our partners here in the community. For the Brookings Area Mental Health Resource Guide, people can go to the helpcenter.org, or helplinecenter.org, capital H, all lowercase, helplinecenter.org, or you can simply call 211. Great resource. They can put you in the hands of the right people, or you can also text 898-211. Once again, 898-211. I'm sure you can post this afterwards as well.
Yep, I absolutely will. So it is 3:57. I wanted to keep this under an hour, but I also want to give you all the opportunity to just say any closing remarks or ask any other questions to one another you might have. Dr. Specker, let's start with you.
Well, I think that Brookings as a community has done a really excellent job. I would like them to keep doing it. We know it's hard for people, but I think the alternative would be harder. I mean, we have to remember the healthcare providers and the health systems really cannot, it's not fair to them to not do well in our social distancing. So
awesome. Dr. Smith?
And I'd like to thank the healthcare providers.
Yes, absolutely.
I think my comment is, if anybody wants to avoid a stay-at-home order, that they should be following what's recommended, which is everyone should mask up. If you're leaving your house, you have it with you, and have a couple so that you can put it in the laundry. And so that is not going to be the one thing that solves it, but that will definitely help. So even if you have no symptoms, remember that if we're trying to avoid more cases, and if you can wear a mask, it's a small step. And really, we just want to normalize it. It is now the normal. So don't feel bad about wearing it. Don't be embarrassed. And I appreciate you guys for wearing your masks together on this call. And so that's one thing that everybody can do. And so if you don't want things clamped down more, wear your mask.
I look really good in my mask. Let me just say, I put a little extra eyeshadow on, and I have to smile with my eyes because people can't tell if I'm mad behind my mask. Jason, anything you want to mention?
Maybe just a couple things. First, there was some questions that I saw coming through on the chat about testing and supplies and some of those sorts of things and turnaround from a lab standpoint. And the challenge we have across this country as we hear and listen to news and some of those sorts of things is that we just don't have enough supplies to be able to run the amount of tests that we really need to run and across the country. And so those are limited. Even in places that have been provided some rapid testing type of analyzers, it's still very, very limited. And our hope is that those get resupplied or have higher supplies in the future. But from those standpoints, the testing swabs and kits and supplies for doing COVID testing is just a scarce commodity right now. And so they are, as was mentioned earlier, really trying to prioritize who is being tested, and then obviously the results of those individuals that are more high priority. And then secondly, I just wanted to say what a great community we live in. We've received so many donations from individuals across this community for PPE and other things that have been provided to this health system, as well as I think Sanford and Avera Clinic. So we've been very fortunate and feel really good about how we sit from a PPE standpoint, but those masks, although there's not many male-friendly masks, I will say, there's a lot of female-friendly masks. They are certainly in abundance, and we so appreciate everything that everybody's doing, and I know my staff does too.
Awesome, thank you. And Paul and Mayor.
First and foremost, just like to thank the community and everyone who's helped us out through some of these difficult decisions that council's had to make. I know on behalf of the council, probably still encourage people to reach out to them as we continue to evolve these discussions, whether it's a stay-at-home order, the current ordinance, or reducing restrictions in the future as well. You can find their contact information on our website. Strongly encourage you to reach out to them, especially as we approach a lot of those city council meetings. Other than that, once again, keep your head up. Brookings is doing some great things. Appreciate everyone doing their part throughout the community to keep our numbers low.
And to Dr. Smith, thank you for re-emphasizing the value of the masks. I know Jason likes them, but I don't. But we still wear them anyway. And I think it's just important that we remind people to wear this mask and the social distancing. As you actually, commented, this isn't going away, but we're the only ones that can make it go away and reduce our numbers. And so the bottom line is that we want to get back to that day of normal, but it's going to take us a while. So,
like Dr. Specker said, the best case scenario is we look back at this and we say, wow, we way overreacted. If we have that, then that's a win.
And I think that's a great closing comment is, yes, it's better to overreact than underreact and deal with the repercussions of that. I did have 2 pages of questions. We got through almost all of them, but there are a few that came through on the chat and things that we did not get to. I'm going to try my best to get those answered and on the our Brookings Area Chamber of Commerce Facebook page this week. So thank you all so much for giving us this time, the city for your leadership, and for seeking out to inform others and to learn from others. We just so appreciate it. And to all of those who joined us, we had over 100 people this whole time. We love it. This was recorded and we will post it on our social media and on the website as well as the city's website. And I can get the link out anyway. So thank you all. If you have questions, you can email me, Kelsey at brookingschamber.org. Also, the City Council has a direct email, citycouncil@cityofbrookings.org. Thank you all, and go in peace.
Thanks, Kelsey.
Thanks, everybody.
Take care.